Dr. Samuels, you mentioned implants, and basically you put this metal rod into the tooth and into the gums, and that's a wonderful thing, you say, and we believe you. So, but in any case, you did say something there that it takes 3, 5 to 6 months to then put the crown, the prosthesis on it. Yet, I see on television, on radio, I see advertised instant implants. Come in today, walk out an hour later. Well, maybe not an hour, but same day anyway. I'm sure you've seen and heard them. What am I missing here? Why would anybody have a 4 or 5 months waiting period to put that, to finish the work when he can finish it right away? Can you shed some light on that?
I sure can, because I actually teach that procedure about putting teeth on implants in an hour, although it's not an hour, it's usually a few hours. But in most cases, an implant needs to be inserted into the bone, and then it must be osseointegrated. It needs time for the bone to actually grow through it and make it rigid so it doesn't fail. If that implant is moved during this so-called osseointegration period, the implant will fail. So for most cases, an implant needs to be placed, and it really shouldn't be touched for a minimum of 2 months. On average, it's 3 months. In the upper arch, it may be 4 months. There are cases, and this is what we had just talked about, where you can load or put crowns on an implant instantly. And those are cases where you're doing a full arch. If you're doing the full upper or the full lower all at one time, so you're going around the arch, there's something called cross-arch stabilization. If you know physics, you understand that. If you were to tie all those implants together at the same time, right at the time that the implants are placed, those implants will then be made incredibly rigid. There are many, many fulcrum points through this cross-arch stabilized implant set, which will prevent these implants from moving at all. They will be rigidly in place. If we had a line of implants, and then we wanted to restore those and put crowns on those right away, well, you basically have one fulcrum line, which is right through those implants. So those implants can tip forward or back. But if you go around an arch, like a full arch in the mouth, and it's semicircular, you will then prevent tipping of those implants if they're tied together. So yes, we can do it in a day or in a few hours, and we do that often, but it has to be a full arch case. Most cases are a single unit, 2 units, maybe 3 or 4 implants placed in various places around the mouth, and in those instances, it would not be prudent to load those with crowns because that could increase the failure rate tremendously.
I see. So it is advertised, and in some cases a patient qualifies, and in some cases he doesn't.
That's correct.
Yeah, let me ask you. So I mean, a patient is waiting 2, 3, 6 months, whatever it may be. During that time, does he have a metal rod sticking out of his mouth and looks like a little hex or so? I mean, or are you going to make him good looking during that time where he's waiting also?
Well, we can make temporaries on implants that are placed right away. We could have the implants actually come through the gums, as you describe, a metal rod in the back of the mouth, and leave it like that. Sometimes the implant surgeon chooses to cover up the metal rod with gum tissue. I mean, there's a whole host of things that can be done. In the front of the mouth, we would never leave a metal rod sticking out where you can see it. Sometimes we restore those right away in some type of temporary. Other times we bury those implants so you don't see them, and then we give you another kind of temporary, so that way you at least have a tooth in the front of the mouth.
Okay, so basically, even though one has to wait to get that last finishing crown put on the implant, the metal rod, one doesn't look ugly in between. One actually can function with it, looks good, and even, bite a little bit as long as it's not heavy work, kind of like, one can basically live life.
Yes, that is true. And if you keep in mind that before that implant was placed, in most cases there was space there. So we've already improved upon that space.
Right, and it is now looking good. Right. And is it true that, like on this one-day implants, that if you... that the best time to put an implant in is right after you perhaps remove the tooth because it can grow the fastest, and in that case it integrates the best?
Well, our biggest concern with implants is placing it in ample bone. If a tooth was there, and then you take that tooth out, the bone has not had a chance to resorb on the outside. So we have the widest bone at the exact time that the tooth is removed. However, sometimes that tooth was badly infected internally, and it wouldn't be a proper place to put an implant in. So we like taking teeth out and putting implants in right away when we can. If we cannot do it, then we usually do some type of bone grafting to build up the bone and wait till the infection is gone before we then place the implant. So once again, it's a case-by-case basis.
Definitely lots of variations, and I don't think any of our viewers here are really going to want to learn about it, because in the end, go to a good dentist, go to a guy who knows what he's doing. He'll let you know the one or two options which exists, and point out which one is, basically the right thing to do, and then go ahead and do that. But the point is, we can replace teeth, we can make them beautiful, gorgeous, and working just as hard as the original one with implants.
That's correct.
Thanks a lot, Dr. Samuel.